Hello and welcome to vlog number 168. I recently had a telephone appointment with one of the DBS neurologists at the National Hospital for Neurology and Neurosurgery in London. We discussed how my DBS hardware was performing, and he asked me to check the battery level of my neurostimulator on my remote control, which at the time was 2.8 volts. He told me to keep an eye on it and to contact the team when it got down to 2.6 volts. On the 24th of August, I checked the battery level again, having checked it on a weekly basis since that appointment, to find that it had gone down to 2.59 volts. I immediately emailed the DBS team to inform them and set in motion the chain of events that would lead to the replacement of my neurostimulator and battery. On the 27th of August, I received a phone call from one of the DBS nurses to inform me that they were writing to my doctor to request that he perform the pre-operative checks on their behalf, and that I would then be contacted with the date for my operation. The next day, I received a call from my doctor asking me to attend the surgery the following Friday, 4th of September, to have the necessary blood tests and an MRSA swab taken. On the 2nd of September, I was contacted by the admissions coordinator at the hospital in London to check my availability for the proposed surgery date of 12th of September, which was just fine with me. I was also told that I would need to have a COVID-19 test 3 days prior to my operation date, so I set about checking the availability of a test. The government website gave different information every time I accessed it to check on available tests. One moment telling me that my nearest test centre was almost 300 miles away, the next that there was one just 4 miles away, and then for 2 days there were no tests available anywhere. I was, by this time, getting a little anxious, so I contacted the hospital, who said that I should still attend hospital on the 11th of September, regardless of whether or not I had managed to get tested. So that took the pressure off somewhat. As it happened, I checked the website at about 5 p.m. on the 8th of September, and there was a test centre with available tests for the following day about 20 miles away from me, so I hastily booked one. I attended the testing centre the next morning, where I was given a test pack and instructions on how to perform the test. 24 hours later, I received an email informing me that the test had been negative, which I kind of knew, but it was nonetheless a relief to have it in writing. I would normally travel to London by train, but the hospital stipulated that I wasn't to use public transport due to the current pandemic, so arrangements were made for hospital transport to collect me from my home in North Norfolk and drive me to the hospital in London. On the 11th of September, I travelled to London, arriving just before 5 p.m, and was admitted to the ward around about 6 p.m, whereupon I was attended by 2 nurses who bombarded me with questions about my general health, any allergies, etc., and swabbed me again for MRSA and COVID-19. A doctor who gave me a physical examination and took about half a gallon of my blood, and one of the neurosurgeons who would be performing my operation the following morning, who marked me up with a black marker pen and got my signature consenting to the surgery. I was fed paper thin ham between 2 rounds of white bread, lucky I wasn't hungry, and then pretty much left alone, apart from regular blood pressure and pulse rate checks. I was first on the list for the morning, so told that I would be going to theatre at 8 a.m, and that the procedure would take about 45 minutes. So, I was showered, changed into a hospital gown, and waiting when they collected me from the ward to go to the operating theatre at about 8:20 the next morning. My surgeon, Ludwig Frizell, came to chat to me about the latest device that he would be implanting, whilst the anaesthetist worked to put me to sleep. And the next thing I knew was when I woke up in the recovery room at about 10:15 a.m. Back on the ward, I was given codeine and paracetamol for pain control, and managed to eat a plate of chicken curry, despite feeling a little bit sore and groggy from the surgery. The rest of the day passed in a blur, and all I'm sure of is that my blood pressure and pulse rate were taken a multitude of times. I vaped some cannabis around 11 PM to help me get off to sleep, and managed to get a few hours of rest before being visited by one of the DBS team at around 8:30 AM for a programming session. This is the Bluetooth controller for the new neurostimulator, which is paired with the device implanted in my chest. Once linked to the neurostimulator, the settings can be adjusted within parameters set by the hospital by a custom app running on this Samsung smartphone, which is linked to the Bluetooth controller. All this means to me, the patient, is that I now have 2 gadgets to lose. The new neurostimulator allows the modification of a setting called pulse width, which they say may enable them to avoid the speech issues that I've been suffering. It allows the user to modify stimulation by increasing or decreasing amperage rather than voltage, as was the case with the previous generation of hardware. The programmer set up a new group of settings for me, which did initially improve the clarity of my speech, albeit at the expense of some tremor control. We agreed to let the new settings soak in for a while, and then I was told that I could go home. Settings review and wound inspection to be arranged for 10 days' time. I arrived home late on the night of Sunday the 13th of September. By the time Monday morning came around, I had so much tremor in my left side, and I was moving so slowly that I decided to change my settings back to the program that I've been using prior to my operation. So I'll stick with those now until my settings review. Thanks for watching. If you have any questions or have a topic that you'd like me to cover in future vlogs, just leave me a message in the comments and I'll do my best to respond. Have a great week, stay well, see you next Friday, motivation permitting.